So, yesterday we discussed basics of radiology and modalities of radiology and important terminologies like first investigation, investigation of choice, and golden standard investigation. Today we will discuss some other important topics. Basically, radiology are also has a part in biopsy also. Biopsy means it is a golden standard test to recognize whether a person is suffering from cancer or any type of deadly disease. Okay. So basically, we have four types of biopsies. Four types of biopsies. One is incision biopsy. Incision biopsy. Second is true cut needle biopsy. True cut needle biopsy. And third one is FNAC, fine needle aspiration cytology. And fourth one is excision biopsy. Okay. So basically, FNAC and true cut needle biopsy are guided by radiology. Okay. Incision directly if any piece of uh, particle is cutted and taken directly from that area and took to the lab. But in today's, this is not utilizing only for skin diseases. Incision biopsy is using. Okay, but FNAC and true cut needle biopsy are the mostly radiology guided biopsies. True cut needle biopsy is like that. One is like gun, in that you have the needle along with you have the cutter. Okay, by in that you have the camera also sometimes. So it will enter into the area by through veins, arteries, any place where you have to go through that. Okay, so we'll insert that with the help of camera. Okay, so you will go through that area and that piece, small tissues to be collected. Okay, FNSC, you will have thyroid gland or soft tissues. Okay, like mammary gland, thyroid gland, pancreatic glands. Okay, whereas you will use FNAC, fine needle aspiration cytology. So where USB guided needle will be insert into that gland because they are the soft tissues. If you want to cut that, it will maximum effect of bleeding and tissue damaging will there. So that's the reason radiologist will do their fine needle aspiration cytology. So where smaller tissues to be collected and it will go to the lab and they will do the biopsy. Okay. So this is the general knowledge purpose only. Next comes to the radiology. Basically, in radiology, we are only on the basic part, introduction part only. So we'll get a lot of different things. Okay. But after starting the class, we'll get a detailed knowledge about that. Here we have in the radiology, you will get three types of radiations. One is a non-ionizing and ionizing ionizing. In the ionizing, again, you have two departments. You have X-rays and you have gamma rays. Okay. In the non-ionizing, we have only two scans, MRI and USG. So they are mostly harmless to the fetus, pregnant ladies. And X-ray, in the X-ray, you will get radiography. Okay, mostly they are for diagnosis and therapy purpose. Okay, therapy purpose. CT scan, DEXA scan, X-ray, explain everything. Fluoroscopy. Okay. In the gamma rays, you will get example PET scan or nuclear medicine. Okay. In the ionizing, you are utilizing the rays, infrared rays, whatever different types of rays we will discuss when we discuss about X-ray topic. But in non-ionizing, you are using waves and magnetic resonance. Okay. Here you are using rays or different types of rays here. So that is the basic difference between this you have to remember. In that, if you go to power, okay, power, according to power, which rays are non-dangerous, from dangerous to non-dangerous, non-dangerous to dangerous. So we have two steps that alpha rays are very, very dangerous. It will even damage DNA of the body. Next is beta rays, and after that X-rays, then is gamma rays. So alpha, beta, X-rays, and gamma rays. So this is the first, second, third, and fourth. Next, if you go to the penetrating, means it will not damage, but it will affect the organ. Something will happen. First ray is neutron rays, gamma rays, and beta rays. Okay. So it will affect the organ, but will not damage the DNA of the organ. Okay. So this is the important things we have to remember, that which uh, rays having which effect. Okay. So if a person exposed to the X-rays or rays, whatever rays, X-ray, alpha rays, beta rays, gamma rays, whatever, so what will effect did he get? What will effect did he get? So basically, from the starting period 0 to 48 hours, he will have some symptoms like vomitings and nausea. Vomitings and nausea are the common symptoms for 0 to 48 hours. If the radiations we have from the sunlight, also you are getting radiations. If you continuously you have radiation, direct radiations on any company or any area where radiations are coming. So if you get radiations continuously from 0 to 48 hours, you will get these symptoms. 0 to 48 hours. After 2 days to 3 weeks, you will get onset or incubation. Means it will enter into your body, it will start damaging. You will get no symptoms, but it will affecting in your body. Okay, after entering into our body after 3 weeks, more than 3 weeks, what will happen? If you continue get radiation, skin will injure. Even though if you are getting radiation, then blood infections will come, then GIT disorder, then nerve damage will happen, and blood vessel damage will happen. Then afterwards, patient die. So this is a very, very serious warnings regarding rays. So we have to protect ourselves till the the rays are like we calculate liquid with ml, the length with meter, like waves with grace, what we'll call grace. So till one gray, less than one gray, your body have the capacity it will can manage. But some radiation have different. We'll discuss that. But after one grace, the body will start this type of symptoms. Okay. So this is very important thing we have to remember. Okay. Now what happened? So we discuss different types of rays. Some rays, okay, some rays are chance, some rays are determinants. Means what is that? If the rays enter into our body, probably it will get placed into our body. Okay. And after period of long duration, the effect of that rays will get into our body. Means if a person exposed to the x-rays more than one grays in his young age, 27 years age, okay, he doesn't have any symptoms more than one gray, three grays, three grays. He doesn't have symptoms. He lived happily without any disease till 55 years age. After 55 years, the effect of this radiation will be start. If have some rays by chance, even after 55 years, he will not that problem also, but having the chances of getting diseases by some race, okay, like cancer, leukemia, genetic mutation, okay, genetic mutation, this will happen. This is by chance. Ha- will he will get affected or he will not be get affected? They are both chances, so we will get by chance. Okay. Next is determinant. This means if he expose, some rays are that if he expose more than required amount, then he will get affected. But by that time only. Means some rays like we know uh, that which rays, alpha rays are dangerous. Alpha rays are very dangerous. So minimum is one gray. So if a person is exposed to two grays, so he started affecting with that rays from after 1 month, 2 month, 3 months, he will get the symptoms. Okay, his skin will burn, vomiting will happen, or then started affecting his body, and he will die with any disease. Means some rays will get in future diseases, or some rays will affect the body within the period of time if you expose more than the required amount. Okay. So this is the important thing. That's the reason in the radiology department we have two things. One is the badge. They will give the badge whoever working in radiation area, and second one they will get the radiation protection. Okay, protection. One is badge. There is a badge in that they have the detector. It is called one second, please. TLD badge, TLD badge, thermoluminescence dosimeter. Okay, this is a badge. In that you have the radiation which will gather in that batch every 3 months. You have to, whoever working, okay, they have to go to that radiation department, and they will check that how much exposure you are getting, and with that your body is affecting or not. So the badge will tell you, even though you are exposing less amount, but you will get the protection. Like whoever working in the x-ray rooms, they will wear some aprons. You saw or not? Okay. In the CT scan, MRI, okay, we will get the protection, that apron. Okay. Next is we have thyroid, means soft tissue protection protector, and gonoid protector. Okay. All you will get. Okay. That's the reason we have the some logos you can see in the radiation department. Okay. Like in the our uh, in the India, we have caution X-ray. They, wherever the radiation is there, you will see the caution X-ray. This logo you will see in that yellow color, like that symbol you will see. Okay, this is dangerous. So this logos are prepared by in our country by AERB. So this is the radiation department, Atomic Energy Regulatory Board. So they will give the guidelines how to protect yourself from radiation. Okay, what are the necessary guidelines? Okay, all this are prepared by AERB, Atomic Energy Regulatory Board. Okay, so these are the basic things what we learn. What are the rays, different types of rays, which rays are utilized by which radiation department, and okay, how the X-rays will damage, what is the time period, what are the different type of damages we have. Okay, and what are the logos, how we'll protect ourselves. Okay, which board all this monitor these things? AERB, Atomic Energy Regulatory Board. Okay, so these are the basic things we learn. So if anyone have any doubts, you can ask.